Hi, my name is Dr. Andrew Tonelli. I practice in North Reading and Boston, and today I'm going to be talking about House Docket 2716. This is an act relative to dental service corporations. This is going to be something that we'll be presenting to our reps and their staff in the State House on April 5th for Beacon Hill Day. I'm really looking forward to seeing you there. With regards to this act, this is the Dental Society's specific response to what's been going on with Delta Dental. I know a lot of you have been thinking about this a lot recently. Many of you may have just signed or chosen not to sign the new contract that they put before dentists and are wondering if that was the right thing to do. And I think it's really important that when we are with our reps and with their staff on Beacon Hill Day, that we talk about how the new contract and the way that Delta has acted in the last several months is affecting you, your practices, your employees, and your patients, and how it will affect them in the future. I know there's been a lot of uncertainty. There's a lot of dentists feel like they were put under duress in having to sign this new contract, and it's important that we convey that in a genuine and articulate way with our reps and their staff, so that they understand just how important this is and can advocate it for us at the state level. Now, in terms of the act itself, there are 6 main components. The first one states that no restriction should be placed on dentists with regards to diagnosis, treatment, or referrals. I know there's been a lot of consternation about the referrals piece of this, that Delta might be able to dictate who you send a patient to, instead of what's best for that patient. And this act will specifically target that piece of the new contract to mitigate its effects so that we can practice in the way that is best for ourselves and our patients. The second piece is that Delta may have no influence on their members' decision of dentist. That's effectively saying that Delta can't try to push their members to specific dentists for whatever reason that may be. The third component is that any licensed and willing dentist could enter into a contract with Delta Dental. And this specifically targets the geographic waiting list that Delta implemented as a part of the rollout of this new contract. I think a lot of dentists saw that for what it was, which was a sort of coercive mechanism to force us into this new contract by stating they would freeze us out if we didn't sign on. I think it's important to talk about that with your reps and their staff, but this act, in terms of something concrete that we can do in order to mitigate the effects of this, is something we can advocate for so that these waiting lists won't essentially come into effect. The fourth component is it will ensure that this new for-profit Delta entity pays fair market value for the services, the assets, and the information that they're getting from the nonprofit Delta. Nonprofit Delta has been able to use their nonprofit status and their imperative as a patient-based organization to build a massive market share in our state, and they're going to take that and they're going to move it over to a for-profit entity and leverage all of that in order to affect the market in really dramatic ways. And this just wants to ensure that if they're going to make this move for their benefit, that they're at least paying fair market value for all of that information and all of that, the services and assets that are entwined in that. The fifth component is that no condition should be placed on a dentist in terms of participating in a PPO in order to participate in other products. This is a main component of the new contracts, where we're all going to be forced into this PPO pool, and the aim of this act is to specifically target and prevent us from having to be forced into contracts that we may not want to be party to. The sixth component is that fees paid by Delta and their fee schedules will be subject to Division of Insurance oversight. So now that we've talked about the 6 main points of the act relative to dental service corporations, I think it's just important to reflect on the fact that Delta was started in the late 60s as a partnership between the Dental Society and the state in order to provide dental insurance for the public that was fair and where the state had oversight so that it could set fair and reasonable prices. And that model has worked wildly successful for the last 50 years. But for some reason, over the last 3 to 5 years, Delta has decided to convert from this nonprofit model to a for-profit model. And in that nonprofit model, their imperative was to their patients, their members, at least in theory. And now they've decided to move over to the for-profit model where their imperative is now to profit. It's to their bottom line. And I think that should raise flags for any of our representatives in the State House and any of their staff and the public at large. You know, one of the things that brought me into dentistry is that it's done such a great job of protecting their profession over the last 50 years. And I think it's really important that we stand up and advocate for not only this act, but the way that dentistry should be practiced in the state and should be delivered to our patients, because otherwise we're going to end up seeing a market that's much different than the one that we exist in today. I think it's interesting that Delta's motto is that Delta is dental. And if things continue the way that they are, I think what we'll see is Delta really will be the driving force behind shaping how dentistry is delivered in the state. And I think all of us can agree that having a for-profit dental insurer set the parameters and the way we practice is not going to be beneficial to us nor our patients. So I really hope to see you on April 5th at Beacon Hill Day. This is a really important time in dentistry. Things are changing dramatically, and it's really important that all of us are advocating for the things that are important to us, our employees, our practices, our families, and I really look forward to seeing you there.